What is the difference between body identical HRT and bioidentical HRT? Well, hormone replacement therapy is a treatment that we use in the UK for symptoms of the menopause, and those symptoms can range from very mild to really severe and impact the quality of your life. In the UK, we tend to use a hormone replacement therapy known as body identical hormone replacement therapy. What this refers to is a licensed and regulated product which has gone through vigorous testing and safety to make sure that it's fit for purpose. Body identical HRT resembles your own natural hormones, so that's either estrogen, which we tend to give through the skin as a patch, gel or spray, and progesterone as a capsule that you take through the mouth. Essentially, body identical hormones are very, very identical, if you like, to what your ovaries would naturally have produced. Bioidentical hormones tend to be slightly different. These haven't undergone the same rigorous testing that body identical hormones have, and so the British Menopause Society, along with other societies in the UK, don't endorse their use because we haven't established their safety or their efficacy.